Hey everyone, welcome back. This is John Coleman. Today we have part two in our video on marathon health, and we have Chad, our expert at on-site clinics and near-site clinics. And today, Chad is going to talk about the patient experience. Chad, welcome back to the channel.
Yeah, thanks for having me back, and I'm glad we get part two to talk about the patient experience.
One of my favorite comedians, and I'll date myself a little bit, is Jerry Seinfeld. And one of his bits back in the day, he said, hey, you go into a doctor's office and they call it the waiting room because you're going to wait. So how would you contrast the marathon patient experience to what Jerry described back in the day?
Yes, well, the waiting room is our least used room in all of our health centers, whether it's on-site or near site. So Jerry wouldn't be waiting too long. We won't have to get the reservation bit, but I like that one too, about can we take a reservation. We definitely keep our appointment times when you make them as well. So when you come into the health center, it is a different experience. I mean, a lot of the centers that are near site, it's much more, it's not your typical doctor's office, right? You don't have the disgruntled kind of front desk worker with a sliding glass and a pen that everyone's touched to sign in. It's very tech forward in the sense of how we check people in and get people in the door. You barely have time to, they know you're coming in. So part of the benefit of this is we can predict who's coming in the door pretty much every time because you have the schedule baked out. Yeah. And then by the time you actually get a chance to sit down in the old standard waiting room and pick up a magazine that everyone's touched, you have a chance to, you don't have a chance to do that, right? You're kind of getting called back to the room. And you're seeing a physician or the staff within, probably 5 minutes from hitting that door at most, which is great because we're not waiting around like an urgent care center or an ER kind of waiting room style. So, and then once you get back there, I think the other key differences that I would say is because of the way we practice and we hire our providers and physicians and that group we tell them to slow down in how they practice, like spend time with people. So don't rush them out the door because again, it's a capitated model. So we're not paid on volume of people that we see every day on claims that we get paid in RVUs and things like that. So we build in, our appointment links are 20 minutes, 30 minutes, and 45 minutes. And
45 minutes. Wow.
Yeah, we allow people to take up to an hour. If you have multiple chronic conditions, you might take an hour in a
That's
physical,
incredible. Yeah, last week I just had a normal preventive exam and I was with my actual doctor for 5 minutes. So 45 minutes is incredible. I can't imagine that.
Yeah, and those are mostly like your physicals or new patients coming in. But the benefit there, I'll tell you my own story that I've shared before is that first time I used one of our health centers, it was for something very acute. And that's a pretty common scenario where employees or their families might engage with the health center for their first time for something acute in nature, right? Yeah. But when you come in, even for something like a sinus infection or something I had at that time, it was startling because I'm used to that experience you talked about being kind of like, okay, rushed out in 5 to 7 minutes and pick up this at the front desk and, give me a call if you have complications. We did go through that pretty quickly. It was maybe 5 or 10 minutes, but then they stopped and asked me about kind of gathering information on my background, like, what healthy lifestyle habits, right? Are you getting sleep? Are you managing your stress? Are you eating well, balanced? Are you getting exercise? Kind of lifestyle based questions. And my first response to that was, well, do we have time for this? Because don't you have another appointment we have to get to and rush me out of here? But they said, yeah, we have all the time you need. And so that probably was a 25, 30 minute conversation. What they were doing at the time, which didn't really click because I'm kind of startled by the whole experience, was they're trying to build trust and rapport with the patient, right? Let them know that they can take their time, but also gather some important health history that they can then put in our system so that when I engage the next time or can feed some of the data and algorithms we have to be able to say, hey, we should probably do some outreach to Chad about this health factor that he has, right? At some point in the future.
The one thing I just want to follow up on as it relates to patient experience. So I'm sure it's going to vary employer by employer, but the employee or their dependent walks into, let's say, a near site clinic. What typical copay can they expect when they go there? What is their typical financial responsibility? Because you're offering a lot of concierge services.
Yeah. Well, it depends on the type of plan they have, right? A PPO and others that some of them have zero copays. A lot of them offer it for free. There's some IRS guidelines that dictate kind of fair market value to make sure that they're compliant for first dollar coverage. So we have the ability to institute a copay. I guess it's usually pretty small. I would say on average, the copays that we would collect would be anywhere from $10 to $25, I would say at most. So it's still going to be cheaper. There's an incentive there. It's a carrot, right? It's still cheaper than going to wait in a waiting room at an urgent care center.
Oh, absolutely. Yeah.
You know, after hours or whatnot. So you can still get in quickly. It's going to be cheaper than, a lot of times cheaper than a primary care provider or a pediatrician would be. I know my wife takes our children there for, we can see children tune up. So that she takes our kids in for their acute stuff because it's quicker to get into than a pediatrician sometimes because they're backed up.
Right. To overuse, I guess, a phrase that's out there. So there's been a lot of talk, obviously, about the Great Resignation and really trying to attract and retain employees, right?
Yeah.
If you're a prospective employee, and you mentioned, your smallest client, I believe, was 20 employees, is it worth, as a prospective employee, to ask a potential prospective employer, hey, do you guys offer us some sort of on-site or Nearsite model to help me and my family members manage our conditions?
Yeah, absolutely. I think it's what you find is when people have access to this kind of service, again, whether it's with us or someone else, it becomes very sticky because they start to get used to a different quality of care and time and attention they get from these dedicated providers and care teams they have access to, right? And again, it's a much more robust scope of services that you would get from your typical primary care office, with health coaches in there, behavioral health specialists, mental health counselors, labs, medications on site, whole host of diagnostic services. So it's kind of a one-stop shop. I'll tell you one other anecdote from that. We had one employer here in Indianapolis who was one of our early employers in our network. They unfortunately were a retailer. This was years ago, but went out of business because retail was tough then. We had maybe 1,000 employees. We had hundreds of their employees reach out to us and ask about, can you tell us who your other clients are? Because we want to keep this benefit and we want to go find a job with one of these other employers who has that benefit in
Incredible.
And we weren't going to give them all of our clients, but we actually ended up creating kind of like a Cobra-like plan that allowed the individual it's one of the few times we've done that, to allow the individuals to pay for that out of their own pocket. And we still have, to this day, this was 5-6 years ago, we probably still have close to 100 people from that organization who ended up working somewhere else, not in the place they had access to it, who pay out of their own pocket still just to have access to this benefit.
That's
because
incredible.
they got ingrained with that provider team.
Chad, if there's an employer out there, or perhaps a prospective employee who wants to learn more about Marathon Health, where can they go?
Yeah, you can go to our website. It's marathon-health.com. We've got ways you can outreach there, and certainly a lot of literature. I'm happy to include my contact information with you to attach to this if you'd like.
Great.
We're out there. We're pretty visible. So, whenever people do wander in off the street, I'll tell you this, we say, hey, go talk to your HR benefits manager about maybe you can add this, right? We can't treat you today because you're not a member, but go ask your HR and your employer about it.
Yeah. So Chad, this has been super, super helpful. Really thank you for joining us today. And for those of you out there, if you like what you see, you want to hear more about this, we encourage you to like the video, comment below. We want to hear about your specific experiences with on-site, near-site clinics. So feel free to comment below. And as always, we thank you for your time and we look forward to seeing you next time.